Welcome to the online version of COVID-19 specimen collection training. By the end of this training, you will understand how COVID-19 is transmitted, the PPE procedures, and will also have a better understanding of the COVID-19 NP and MT swab collection process. So how is COVID-19 spread? Per the CDC, it is spread primarily via respiratory droplets, which can be generated during coughing, sneezing, or talking. It may also be transmitted via direct or indirect contact by an airborne means. There are some general principles we should abide by in regards to PPE use. You always want to don your PPE before any patient contact and be careful when doffing the PPE to avoid contamination. In addition, hand hygiene should be performed before and after all encounters and as needed. Finally, reusable PPE should be properly decontaminated per guidelines provided between uses. Hand hygiene is equivalent to alcohol-based hand sanitizer, also known as ABHS, and/or soap and water for 20 seconds. Visibly soiled hands should be washed with soap or water when followed with the ABHS. The PPE required will depend on your proximity to the patient. It may include hand hygiene solution, N95 or surgical mask, gloves, eye protection, gown, hair cover or hood, and booties if indicated. If you are instructing the patient on the mid-turbinate self-swab procedure and are at least 6 feet away from the patient, you may use a procedural mask and gloves. If you are within 6 feet of the patient, you will need a higher level of PPE, including an N95 mask, gloves, eye protection, and a gown. Maybe one of the most important part of this process is the donning and doffing of PPE. To put on the PPE, we have to go through 4 steps that have to be done in sequence. The first step is to put on the gown, making sure we are fully covered from the neck to the knees, and the gown is fastened in both the neck and the waist. The second step is putting on our mask. When putting on our respirator, we want to ensure that it fits snug from the face to the below of the chin. And third, put on our goggles or face shield, adjusting it to fit so that it doesn't fall off. And finally, we put on our gloves and ensure that they go over the isolation gown. Do not touch your face and other unnecessary surfaces, and you can change your gloves when it is torn or becomes too soiled. Perhaps the most important part of the process is the doffing. There are 2 ways that you can doff your PPE, but both involve 4 steps and they have to be done in order. In the first example, you start by carefully removing your gloves, making sure that they do not contaminate your hands, which is underneath the gloves with the outside of the gloves. You do this by peeling off one glove by grasping the palm area of the other glove. You then slide your finger of the ungloved hand under the remaining glove and peel it off. After removing your gloves, you can then take your goggles or face shield off by lifting the headband from the back. The next step is removing the gown. You start by unfastening the ties of the gown and make sure your sleeves don't touch your body. Touching only the inside of the gown, pull it down from the neck and shoulders and turn the gown inside out. Carefully roll the gown into a bundle and discard. Finally, remove the mask or respirator by first grasping the bottom ties and then the top ties from the back without touching the front. Wash your hands or use an alcohol-based hand sanitizer immediately after PPE removal. In the second example, the first step is removing the gown and gloves simultaneously. Remove the gown by grasping the front of the gown and pulling it away from your body, breaking the ties. While removing the gown, fold the gown inside out and remove the gloves simultaneously only touching the inside of the gloves and gown. In the next step, you remove your goggles or face shield, and finally, you remove your mask or respirator, following the same process as example 1. Remember to wash your hands or use alcohol-based hand sanitizer after PPE removal as well. When doffing, always keep in mind to keep clean separate from contaminated. Examples of clean are the ties and the inside of the PPE. Contaminated includes the outside and the front of the PPE. Now we can talk about the NP swab. What is an NP swab? A nasopharyngeal swab is one of the methods used to treat for the COVID-19 virus. This process is done in the lab and is called the reverse transcription polymerase chain reaction. This technique reverses the transcription of RNA into DNA and amplifies specific DNA using a process called polymerase chain reaction. What supplies do we need for the collection process? You will need a trash bag, biohazard bag, hand sanitizer, pen or marker, lab requisition form. Please make sure that the form is marked for COVID-19 testing, the media tube used to hold the collected swab, and the sterile synthetic fiber swab. Make sure to not use calcium alginate swabs or swabs with wooden shafts. These will inactivate some viruses and inhibit the PCR testing. To prepare for swabbing, label the specimen tube with the patient's name, date of birth, the date and time of collection, and the tester's initials. Complete all starred items on the requisition form and insert it into the outside pocket of the specimen bag. Please ensure that the information on the label and lab requisition matches exactly to prevent delays or rejection of the specimen. Let's now go to the swabbing process. Before you begin, remember to perform hand hygiene and don your PPE. Always explain the procedure to the patient and set the expectations that the process may be uncomfortable, as it can tickle, it can make their eyes water, and even make them sneeze or cough. Ask them if they have any obstructions in their nose. Also inspect the nostrils and pick one of the most secretions. Have the patient tilt their head back about 70 degrees. Instruct the patient to not pull back when you insert the swab or have them rest their head against the wall. You can also place your hand on their chin with a non-dominant hand to prevent them from moving their head during the process. Insert the swab into one of the nostrils and leave in place for a few seconds. Insertions are easier if the swab is parallel to the palate of the mouth, instead of pointing the swab towards the brain. The swab should be inserted to the red line. You can then slowly remove the swab while rotating it and place the tip into the transport vial. Finally, snap off the excess portion of the swab that doesn't fit into the vial and securely cover the vial with the top. Ensure that the cap on the label specimen tube is secure. Place the tube in the specimen bag that has the completed lab requisition. Carefully place the specimen bag in the cooler containing frozen cold packs and ensure that it is maintained at a temperature of 2 to 8 degrees Celsius. For specimens stored in a specimen refrigerator, ensure that they are properly labeled. If stored in a refrigerator with vaccines, make sure it is in a separate bin and on a separate shelf under the vaccines, and the temperature is not compromised. Now we will talk about the nasal mid-turbinate swab. You will need a trash bag, biohazard bag, hand sanitizer, pen or marker, lab requisition form marked for COVID-19 testing, the media tube used to hold the collected swab, and the sterile synthetic fiber swab. Complete all starred items on the lab requisition and prepare the specimen tube before handing to the patient for self-collection. Ensure that the information on the tube label exactly matches the lab requisition. Mid-turbinate nasal swabbing is usually administered as a self-swab, though there may be settings where the nurse may need to assist or perform the swabbing. The mid-turbinate nasal swab is less invasive than the nasopharyngeal swab and therefore may cause less patient discomfort. Before you begin, remember to perform hand hygiene and don your PPE. Always explain the procedure to the patient and let them know that the swab may tickle, make their eyes water, or make them sneeze or cough. Instruct them to partially peel back the swab package and carefully remove the swab, making sure the swab tip does not touch anything. Holding the swab by the non-swab end, instruct the patient to carefully insert the swab into the first nostril, approximately 1 inch. Ask them to rotate the swab a few times. Hold in the nostril for approximately 15 seconds, then remove the swab. Next, they will repeat the process in the other nostril with the same swab. After the patient has swabbed both nostrils, have them unscrew the cap from the tube and immediately place the swab into the tube. Snap off the swab shaft at the score line and firmly close the tube with the cap. Finally, we have to disinfect the equipment after the collection process. All non-disposable equipment used for patient care must be cleaned according to manufacturer's instructions and facility policies. To clean surfaces or patient care areas, routine and disinfection procedures are appropriate. For a list of disinfectants that are qualified by the EPA for use against SARS-CoV-2, refer to List N. You have now completed the COVID-19 specimen collection training PowerPoint. There are 3 demonstration videos to view before completion of this training.